In the previous session, I talked about central paroxysmal positional vertigo. In this session, I would like to discuss 2 to 3 typical cases of central paroxysmal positional vertigo caused by the neck, in other words, via poor circulation in the vertebrobasilar artery due to stiff neck and shoulders based on cervical spine abnormalities. However, the relevance of stiffness in the neck and shoulders to vertigo has been known in traditional Japanese medicine for a long time. A TV station in Tokyo once asked me to appear on a TV program, and the director, who was planning and broadcasting the program, went to a well-known doctor to ask for his opinion. I have heard from someone that the program was scrapped because of the doctor's assertion that stiff neck and shoulders have nothing to do with vertigo. This statement seemed to me to be an indifference to the relation between the tension in the cervical muscles, especially the deeper cervical muscles, and the easy excitability of the sympathetic plexus that surrounds the vertebral artery, due to neck and shoulder stiffness. In addition, the link between neck muscle tension and vertigo was already published in a neurology paper, but it was not well known yet. Anyway, not all persons with stiff necks and shoulders suffer from vertigo and headaches. As I will explain in detail on the next slide, there must be an additional factor, or trigger factor, that leads to vertigo. Next case had vertigo caused by kyphosis due to prolonged operation of a computer in a slouching posture. Nowadays, the number of people who operate computers, smartphones in a forward-leaning posture for long periods of time in a sustained manner is rapidly increasing. They often have text neck, that is, straight neck or kyphosis, and have strong stiff neck, shoulders, which is also a contributing factor to vertigo. More details will be explained in the next. Because of these social conditions, neck-related vertigo is often common, but easily unnoticed. So it is not always otoless. The case is a 56-year-old man, a first-class architect. This case was aired in July 2016 in November Encore broadcasts, and was broadcast nationwide on NHK's 2 channel, television program called Choice. The content was about a patient with central paroxysmal positional vertigo caused by neck and shoulder stiffness resulting from cervical kyphosis. At that time I also commented on the program. He had previously visited an ENT specializing in dizziness with vertigo and was diagnosed as benign paroxysmal positional vertigo. He was treated with exercise and physiotherapy, which has now taken the world by storm, with the aim of returning the otolith to the oval sac, but it was completely ineffective. Moreover, the vertigo worsened. Then the doctor said, "That's strange," and tilted his head. He subsequently visited the department. The nystagmus was indeed the same as benign paroxysmal positional vertigo, but a cervical spine X-ray revealed that he had kyphosis. Normal people have a forward bend, but this is reversed and the kyphosis is backward. His neck and shoulders were stiff like boards. I told him to lower his pillow, and recommended massage and acupuncture as well as medication. As a result, the vertigo disappeared. A short time later, he slept with a convex pillow on top in the site of cervical kyphosis in an attempt to correct the kyphosis on his own this time. He was re-examined for this reason as he began to experience wobbling dizziness again. The nystagmus was found to be pure rotatory nystagmus in the right inferior and left inferior cephalic positions. This finding was the same as benign paroxysmal positional vertigo, but judging from the patient's history, the factor was thought to be the cervical spine. First of all, cervical kyphosis causes strong stiffness in the neck and shoulders. This makes the sympathetic plexus surrounding the vertebral artery more excitable due to stiff muscles. However, this is not enough to cause vertigo. Then why does vertigo occur? In this situation, several additive factors, in other words, 2 or 3 factors that can trigger vertigo for the patient, can cause vertigo. This is the most important point. Without these additional factors, even if there is strong stiffness in the neck and shoulders, it will not immediately lead to vertigo. Therefore, as I mentioned earlier, if this is not well understood, when the TV director went to a famous doctor for his opinion, he was declared by the doctor, stiff neck and shoulders have absolutely nothing to relate to vertigo. It is impossible. The question becomes, what are the additive factors? The additive factors are, for example, when there is a sudden change in head position, such as looking up or down, or when the blood pressure suddenly drops for some reason, or when there is added mental or physical stress. Stress hormones such as adrenaline, noradrenaline, cortisol are released from the adrenal glands in large amounts. Then these stress hormones cause arteries to constrict and platelets to become activated, resulting in stagnation of blood flow. These facts have already been proven in the United States. Therefore, poor circulation in the vertebrobasilar artery, which is related to vertigo, that is, impaired blood flow in the brainstem and cerebellum, causes vertigo. So why not the three semicircular canals of the inner ear? This is because the function of the brainstem or cerebellum tends to deteriorate before that of the inner ear in middle-aged and older people, except when they are young. Accordingly, this is the reason why the name, central paroxysmal positional vertigo, is used. Conversely, the phenomenon that this poor circulation improves when vertigo subsides has already been proven by an echo examination of the vertebral arteries at the Department of Radiology of Nara Medical University. This phenomenon is not yet widely known among doctors. In the 1970s, Dr. Jiro Hazawa, professor at Hirosaki University Department of Otorhinolaryngology, published a paper that showed nystagmus similar to benign paroxysmal positional vertigo in vertigo originating in the neck, but it has been largely ignored. Recently, an American otolaryngologist has expressed the opinion that the same nystagmus as that of benign paroxysmal positional vertigo is also observed in vertigo caused by the neck, but this too is still not well known. Therefore, if patients have a reasonable medical history and directional alternating nystagmus, the diagnosis of benign paroxysmal positional vertigo is immediately given, and exercise and physical therapy are indicated, which may actually make the condition worse in some cases.